Hi, so it's 8 o'clock, give or take. Making some camera adjustments. All right, so I'm just going to give it a few moments, give it some time for people to come on the stream. Tonight, of course, we're going to be talking about the Canadian healthcare system. I can't seem to walk so much as 5 feet in my life without hearing someone say something about the Canadian healthcare system and how horrible it is, socialized medicine, you name it. You know, there are a lot of misconceptions about what this is. How y'all doing? Joe, love you. Jack, everyone say hi, get to know your neighbors. We're all family here. Diane, nice to see you. Lana, awesome. Oh, they're piling up quickly. Okay. All right, well, I'm just going to dive right in then. So as you all know, I am a healthcare professional. I'm a certified medical assistant. That's what I do. That's my job. And I also lived in Canada. I was raised there. I was born in North Carolina, and I moved to Montreal when I was barely a year old. Bit of a misnomer. My family moved to Montreal, and they took me with. Didn't have much of a say in the matter. And I'm very grateful that that happened. You know, I've lived in a lot of different places. Hey, Sandy Dog. I've lived in a lot of different places in the world. I've lived in different places in the U.S. And I can tell you, hands down, no one on the face of the earth has the best health care. Because everyone leaves something out. Part of that is just, we're human. You know, we're not perfect. You know, so if you hear anecdotes about the Canadian healthcare system, well, I know someone who waited forever to have a knee replacement, or I know someone who came to Canada, who came to the States specifically, hi Joe, specifically to get care because they couldn't get it in Canada. There is some truth to all this. No matter where you go in the world, you're going to find problems. You will go to any country and you will be able to find people that don't like their healthcare system. It does exist, including Canada, including England, including Germany, including France, including all these other countries that provide universal coverage or something thereof. And you will be able to find the exception. You'll be able to find the person that got screwed. You'll be able to find the person that got fallen through the cracks. It does exist. So I'm going to start off first and foremost in the name of full disclosure. That does happen all over the world. And it happens here too. In what would be universally acknowledged politically. That America has the greatest health care in the world. The envy of the world. The third leading cause of death after heart disease, cancer, medical errors. Medical errors count for the third leading cause of death in this country, in the United States, the greatest healthcare system in the world. And depending upon your estimates, depending on which numbers you want to go by, 98,000 up to 440,000 a year. Medical errors in hospitals. I think it was in 2008, thereabouts, when the NIH did a study of their Medicare patients and found it was upwards of 180,000 just in Medicare. Just in Medicare. So don't tell me that the United States has the greatest healthcare system in the world. When depending upon your estimates, anywhere from 99,000 to 440,000 people are dead needlessly because of errors. Now, I talked last week about fee for service, about how there was such a push to test more, to do more surgeries, to do more. Not because it's good for the patient, but because it's good for the hospital's bottom line, for the medical manufacturer's bottom line. And yes, in several instances, the doctors, bottom line. I remember the days during the 90s when that number was 99,000. Yeah, those were the days, Dr. Joe. Those were the days. Not anymore. Not anymore. So it's really important that we get our brain around the idea that first and foremost, no system in the world is perfect. And we're going to have to own up to that. We're going to have to face our own humanity, our own fragility, that we can't save everyone and that we ourselves are human, and we're going to have to deal with that. But it's clear that other countries deal with it a lot better than we do. A lot better. If you look at the links that I put up, I just put a scattering of links up there. Not even all that is available. But in just that scattering of links from Washington Post, New York Times, CBC, Vox News, there's a bunch of different sources of information up there. You'll find that the rationale of Canadians coming down for health care is wait times, because there are wait times in Canada. There are. They're just not that horrible. Got myself some Crip notes. Let's see if I can find. Did I bring down the wrong list? Yeah, I did. I brought down the wrong one. Oh well. Such is life. But just off the top of my head, what we're talking about, in terms of wait times, they're trying to get in Canada wait times down to about 3 hours. And those wait times have come down steadily over the years, till the average wait time in Canada for an emergency room visit is about 3.3, 3.4, something like that. But there are hundreds and hundreds of hospitals in Canada that have their wait times significantly lower. Some are higher. So the question becomes, in the case of wait times, and why some Canadians would consider going elsewhere, to have their needs met. If wait time is the issue, if you're a real progressive, if you are someone who understands where the dollar comes from in a fiat currency, wait times is entirely about money. If they want to be able to deal with the wait times, all the Canadians have to do is spend more money. Now, politically, they have decided not to do so. And in fact, if you look at the links, and you'll see that there's one from the Canadian government outlining what is the Canadian healthcare system. It's largely provided by the provinces, what we would call states. So how they choose to fund it is fundamentally different from the way they need to. What they need to do is just simply fund it from the federal government. Right now, the Canadian system is a system whereby we, as a nation, Canadian nation, decide that this is what healthcare should be. It should be absolutely 100% available to everyone, regardless. And they prioritize, not based upon how much you can pay. If you can pay more, you get to the front of the line. That's the American system. What they prioritize is need. If your needs are great, you will be seen. If you need a life-saving operation, you're going to get that life-saving operation, and it's going to be a great service. They got incredible doctors, incredible hospitals in Canada. And if you have that need, you will be seen. If you have a need, but it's not life-threatening, well, that's when they start prioritizing, and you might start to wait. But that is entirely a political decision. That has nothing to do with necessity. It has nothing to do with the quality of their system. Their system is awesome. Their system is incredible. It's just not being utilized. They have this great system that they've put all kinds of artificial constraints upon it. And they don't need to. It's not necessary. They could unleash the potential of their healthcare system. And it only takes money. And money to a sovereign government with a fiat currency is nothing. It is nothing at all. It's all about the resources. Do the Canadians have the resources in infrastructure, hospitals, clinics, doctors, nurses? Do they have what they need to cover everyone? Everyone that needs care for anything they might need, regardless of what that need is. It doesn't matter if it's heart failure or an ingrown toenail. From sea to shining sea, the hospital should be open to everyone. And no one need ever see a bill. Unless your doctor's name is Bill. But that's it. The Canadians have a system that is incredible. But they are choking the life out of it with these artificial constraints. And they don't need to. And slowly, they are releasing those constraints. They're just not doing it in the way that I would like. Provinces are having to deal with it themselves. It's the same thing as California having to figure out their own way to do it, and New York having to figure out their own way. And by figuring out their own way to do it, I mean get more money, get more revenue. It's not necessary. They're doing it wrong. They're doing a great thing badly. But that's just finances. That's just politics. At the end of the day, if you need care, you're going to receive that care. And the Canadians know this. Canadians know that if they need something, they're going to go and they're going to get something. Yes, they may have to wait a little bit, and they accept that. They understand that it's about money. To them, it's about money. They don't really get exactly that it's really about resources. But it doesn't matter because they accept it. They accept that we as a nation are going to take care of one another. That's what a great nation does. A great nation does not wait for you to heal yourself, does not wait for you to fix yourself, does not just hang out and watch you die, scratching your head going, I wonder why they don't fix themselves. I wonder what's going on there. Well, I guess I could help them, but damn, that would just be against my policy of only helping myself. No, man. Canadians don't do that. The English don't do that. The French don't do that. The Italians don't do that. The Spanish don't do that. The Australians don't do that. Americans do that. That's a fundamental American value if we understand what a value is by what is put into practice. Americans will speak a great game. Freedom. I want freedom. What they really want is anarchy. Because freedom, as they define it, is I'll do what I want, when I want, and you're not going to have anything to say about it. I want what I want, and I will take what I want. And if that steps on your toes, sorry. I am, after all, the chosen one, and you are... Who are you again? Clearly not important. My name is Paul Ryan. But that's the American value in practice. But there's hope. Because if that's the way it is in practice, if that's the way people are practicing their values, then they can practice something else. Because it's a choice. The Canadians choose their healthcare system. They love their healthcare system. They understand that it is revered around the world, just like the healthcare system in England. But in England, they're actively trying to kill it. They're actively trying to privatize it, make it more American. What's the American system again? Not everyone is covered. Tens of millions of people right now have no coverage whatsoever, which means they have no access to health care. 45,000 people die every year because of lack of access to health care. And upwards of 440,000 people die every year because of medical errors. How fucked up is that? We pay almost twice as much as the next top country. We have drastically lower outcomes than any of those other countries. We rank last in patient satisfaction, in doctor satisfaction, in life expectancy. We are last. We pay more and we get shitty fucking outcomes. And that's the great American system. So why is this? Why do American politicians say that socialized medicine is terrible? And if you need to know for yourself how terrible it is, in the words of George H.W. Bush, ask a Canadian. Well, I'm a dual citizen. I was raised in Canada. My mom was sick in Canada. My mom fought breast cancer for 15 years. I kept going to different parts of her body. 15 years. 15 years of activity. 15 years of productivity. 15 years of never, not once, having to worry about where the bill was going to come from. Are we going to be able to keep the house? No one went broke. No one. Whatever procedure she needed, she got. No one lost a house. The only things we worried about is how's mom doing? I'm a dual citizen. I was raised in Canada. You want to find out how good or bad the Canadian healthcare system is? Ask a Canadian. Here I am. It's awesome. It is flawed, but it's awesome. Because it already has as its center, as its cornerstone, everyone gets covered. It doesn't matter how much you make. It doesn't matter. You get covered. Now, it could be better. As I was saying, they could open up the floodgates, make it even more inclusive, make sure that there's no wait times whatever. As it stands right now, they don't cover prescription drugs, they don't cover vision, they don't cover dental. They don't cover non-emergency care, so plastic surgery as an example. You know, if you want to get your breast implants, woohoo, fantastic, good. But you're paying for that yourself. And they don't need to. I've said this many, 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 many times. If there's a 65-year-old man who wants to have breast implants, it should be covered. There's no, financial restrictions in covering someone's breast implants. I'm not saying we should do it, but go for it, dude. And the Canadians could do that. But they're already almost there. Fundamentally tweaking how they pay for it, switch it to the federal government that needs no revenue stream, and then cover more. There'd be no more wait times. Prescription drugs would be covered completely. Vision, dental, everything. Dudes' breast implants, everything. Want to get breasts on your knees? You're weird. I like that. Covered. So every American politician that says that the socialized medicine is horrible, they don't understand socialized medicine at best. At worst, they know it all too well. But they're too busy making money. They want money. That's all they want. They don't want you to get better. They don't care if you get better. They're making millions of dollars. Millions. No one is poor in Congress, House of Representatives or Senate. If you go in, not necessarily part of the 1%, you're going to come out at least in the top 20. Guaranteed. They want money. Kellyanne? Okay, breast might break the system. Okay, maybe it would. I don't know. I'm just thinking out loud. But they want money. That's it. They don't want you to get better. They don't care if you get better. It's not important to them. They want you sick enough to not be able to do anything, distracted enough to not realize there's anything you should be doing, stupid enough to not realize that there's something you should be doing or know what to do about it if you did. They want you to be able to help them move some dollars around. Their dollars. Dollars for them, not for you. Health is for them, not for you. That's a political choice. And they'll tell you that Canadians are flocking across the borders to be able to get care. That's bullshit. Flocking? Trump, the Cheeto in chief, the overbaked potato chip, used to like to say that, what was it, in 2014, 54,000+ Canadians got care overseas, not in Canada. And that represented a 25% increase from the previous year. So what are you going to do with that information? Wow, 25,000+ people in a year. That's incredible. You want to know what that research actually said? The link is up top. Read the article. 25,000 people, absolutely. It is a 25% increase from the year before. It doesn't state where these people went. Doesn't say they all came to the United States. It doesn't say that they needed to. So we're also including people who were already overseas and needed emergency care. But the most important thing, 25,000 people. 25,000 people. I'm sorry, 52,000 people. 25% increase. What is the population of Canada at that time? Over 35 million people. Over 35 million people. And 52,000 people in a year sought health care abroad. That is less than 1/10 of 1%. That is not an invasion. I think we can take them. Less than 1/10 of 1%. That is bullshit statistics. That is a statistic designed to manipulate you. You tell someone 52,000 people are doing something and you think, wow, that's a big number. But you don't put it in context purposely. So let's find out, why do 52,000 people seek health care? And let's be really generous. Let's be really generous. And let's say that all 52,000 people sought care in the United States. Not elsewhere, even though the study specifically says we don't know. But let's be really generous. If all 52,000 people did, in fact, seek care in the United States, left Canada, came across the border. Why would they do that? Well, okay, so we got wait times. That's a possibility. Maybe they didn't want to wait. So they didn't want to wait to have their knee replacement, for example. It's not life-threatening. It's medically necessary because you could be walking and we want you to walk. But it's not medically necessary as a life-saving procedure. So you're going to have to wait. Well, you don't want to wait. Totally understandable. Canadians should be spending more. The Canadian government should be spending more. But they don't. You don't want to wait. You want to get your knee replaced. Fair enough. And power to you. I got nothing horrible to say about that. You do what you got to do. The problem is not your desire to not wait. Your problem is that the Canadian government is not spending enough. It has nothing to do with the quality of their system. It is everything about how much they choose to spend on that system. And then you got other situations where you want to get an MRI, you want to get certain things, you're just simply going to go across the border. And then you're going to have situations where they want to get, an elective procedure that, they're just going to be waiting for. Why do they go to certain places? Advertising. Hospitals in the United States advertise in other countries. They advertise in Canada, they advertise in England, they advertise in China, they advertise in Saudi Arabia, they advertise all over. They're looking for people with money. They don't cover everyone in their own country. We have tens of millions of people that have no access to health care, and they will die. But hospitals, instead of finding a way to cover these people, to get them to come to their services, seek outside the country to find people with disposable cash to come into the United States for care. Now, don't get me wrong. I got no problems with the fact that they advertise. I've got no problems with the fact that people come here for care. What I want is for us as a nation to be able to help other countries so that to improve the quality of their care so that people don't have to go across a border. You shouldn't have to. The quality of your care should equal ours. We're in a global community. We should be able to be looking out for one another. Now, until that happens, please come to the States, get care. We love you. That's what a doctor should do. That's what a hospital should do. You turn no one away. But we shouldn't be predatory about it. The quality of care should be excellent, should be free. The federal government should be funding this. The federal government is a fiat currency. We have no financial constraints. Said it before, I'll say it until I'm blue in the face. It's not taxpayer money. Taxpayer money funds nothing. So, at the end of the day, why do people come? Why do Canadians come? It's barely a tenth of 1%. Why do they do it? Advertising, and the Canadians don't spend enough. So the politicians will say, hey, people are coming in droves to come here, so clearly we must have an amazing healthcare system. They clearly must suck. And we can't possibly emulate their system. Couldn't possibly. Because then we would have people from the United States going somewhere else. Why would we do that? It's about political choices. The Canadians have chosen to not spend as much money as is needed to be able to fully fund their healthcare system. All we have to do in the States is say, we're not doing that. We're going to have the single-payer system. It's going to come from the only source that it can come from in order to be able to do it properly. That's the federal government. It's the only source that can do it. California is trying to get their own universal health care system. In New Jersey, we're trying to do the same thing. Many different states are trying to do it. They're currency users. They have to find the cash somewhere. California can't just simply start printing bills and saying we're going to spend as much as we need. There's going to be concessions. There's going to be shortages. We already have a system that is immoral, that already has rationing. I'm on the phone every goddamn fucking day with an insurance company that wants to deny someone a certain medication or wants to deny someone a test that a doctor wants to do. An insurance company. And people say that if we have socialized medicine, you'll have a bureaucrat in Washington saying what you can and can't do. It already fucking happens. Instead of a bureaucrat that you have to elect and who will be answerable to you, you would rather be told what you can and can't do by a bureaucrat in a corporation that doesn't have to answer to you at all, ever. Now, I'm not saying a single-payer system is easy or perfect. No government is going to be completely responsive. But if they're not, it's not their fault. That's our fault. It's time that we got up off the sidelines. It's time that we started acting like the citizens that we should be, that we should always be. An active, participatory citizenry. Well-informed. Ready to rise. Ready for action. Ready for positive change. Not just fists in the air, just randomly angry. That's fear. Fists in the air, sure, but with love, with intention to make a positive change, with a plan for this is what we're going to do. This is why. This is the moral way to go. This is how we're going to do it, and we're not going to stop until it gets done. I'm not interested in incrementalism. I'm not. Incrementalism has been going on in this country in the name of healthcare for 40 plus years, 50 years, 60 years. And we still have a system, after all that time, that covers not enough people. And by not enough, I mean if there's one citizen that doesn't have healthcare, that's not enough. And we have tens of millions who have no access. The current ACA, if it goes away through political choice, will throw off another 20, 30, 40 million. It's fundamentally fucked up. Incrementalism, after all this time, still gets us the most money spent, the worst possible outcomes. At least 220,000 to 440,000 people dying needlessly in hospitals. 45,000 more people dying every year because they couldn't even get into a hospital. This is incrementalism. This is unacceptable. And incrementalism into the ACA is still people paying. Is still an insurance company telling you what you can and can't do. It is still trying to contain costs when it's not supposed to be about money. Money is immaterial. Resources are what matters. It's the only thing that matters. Can we do it? Do we have, if money were no object, because it ain't, do we have what we need? And we do. So people die for nothing. Nada. And the politicians want you to believe that we can't possibly have it. That even the Canadians don't like their healthcare system. That Canadian doctors don't want to be in Canada. That they want to come to the US. And there was a time when upwards of 400 to 500 doctors a year in the mid-90s were coming to the United States. There was a time. That did happen. What's happening now? The 90s, that was a long time ago. What's happening now? There was net immigration to Canada. There are more doctors fleeing the United States to go to Canada. Why? Because doctors in this country are tired. They're tired of not being able to be doctors. They are tired of not being able to take care of patients. They're tired of just grinding it out, having to spend less and less time with patients, being doctors, and more time arguing with insurance companies, filling out forms. It's disheartening. You'll find it all over, in private practice, in hospitals, in specialist office. The only ones who don't really suffer like this are the ones that are in private practice in ultra-rich areas where they basically take cash. And they can charge as much as they want because the patients will pay them because they can afford to. And they can choose how many patients they'll see in a day. So having money really does work. So instead of creating an economic system that makes sure that your average American has no fucking money, that you shovel everything to the 1%, and they can afford anything, including the greatest healthcare, they wait for nothing. Your pharmaceutical bills are in the tens of thousands, and that to them is how much they spend on toilet paper. The highest quality for my derriere. But for the rest of us, it's a fucking nightmare. So if money buys the best healthcare, then the source of funding for healthcare has to come from the only source that has an unlimited supply of it, and that's the federal government. Article 1, Section 8 of the Constitution. They create the currency, they set its value, and they ensure the use and need for that currency through taxation. There's no way that a system like that ever needs a revenue stream. Ever. The Canadians have it. We have it. Australia has it. England has it. Numerous countries around the world have a fiat currency. They can afford anything that's for sale in their own currency. The only constraint is resources. That's it. So don't wait. Don't wait for the politicians and the media to do it for you. I've been waiting. I'm 48 years old, and I've waited most of my life. I've waited for the politicians to do it for me. I did not think that I had a voice that anyone would listen to. I did not believe that there was any way that I could affect any kind of change. And you know what? I can't. Not on my own. It's not possible. On my own. But what if I had a few friends? What if I had a few, I don't know, maybe 100 million friends who all previously thought that there was nothing that they could do, that they would leave it to the politicians or the few really well-intentioned and some very effective small groups to do the work for them? What if they all suddenly realized it's not going to happen that way? It can't happen that way. It has to be all of us. It has to be all of us waking up and understanding that for decades we have been lied to. Everyone that says that it's taxpayer money, they are lying to you if they are in Congress. I promise you, they are lying to you. They understand. They understand perfectly well. If you're not in Congress, I certainly understand that you might have been lied to and you didn't realize that you were being lied to. But as soon as you're in Congress and you vote for your very first appropriations bill, you know very well that Congress doesn't need a revenue stream. If it doesn't set a pay-for section in the bill that it's passing, taxes don't need to be raised, programs don't need to be cut. Continuing resolutions, to keep the government funded. Funded by who? From who? It's not us. Taxpayers don't fund anything. I understand that it just makes so much more sense. It makes so much more sense if you think of the government like a household. And why would you do that? Well, only because the government has been telling you for decades that that's exactly what it is. You'll find Democrats and Republicans both telling you the government is like a household. We can't spend money we don't have. The government neither has nor does not have dollars. It creates dollars every time it writes a bill. And if it wants to put in that bill that we will not only fund this, but we will also cut spending somewhere else, well, then that's a self-imposed restriction. It's bullshit. It's horseshit. But if they want to do it, they can do it. There is a lot of self-imposed limits that Congress puts upon itself. Very little of it in the modern era is a good idea. What they need to do is balance the economy. Balance the resources. You don't need to ever balance the books if you create the currency. Because if government is a household, I have a household. I want to be able to print my own money. You call it counterfeiting now, but if government is a household and it prints its own money, I'm a household. I must now be able to print my own money, and you have nothing to say about it. And since I can't, then we're going to give up once and for all this notion that a government is a household. A government is no more a household than a corporation is a fucking person. So shut the fuck up with all that shit. So, to summarize, the Canadian healthcare system is wonderful. Is absolutely wonderful. It is imperfect. It is flawed. Why? Because people are flawed. But it suffers from one thing. It doesn't fund enough. It doesn't fund enough. All the wait times can go away if you just simply throw more money at it. Guaranteed. There will be no more wait times. You will simply have more doctors, more clinics, more medical resources, more equipment. An MRI for every man, woman, and child. You'll have an MRI in your living room, funded by the Canadian government. Not a problem, as long as there's enough resources to give everyone an MRI in their living room. It's not about the money, it's about whether or not we can actually create that many MRIs. That's it. And as soon as people wake up to that idea in Canada, they'll realize that their government is not funding it enough. And it doesn't have to raise or lower their taxes one bit. You just simply have to pay to the public purpose. The government exists to take care of its population as we, as citizens, take care of each other. That's how a civilized society works. From the 10 Commandments on down. It's about taking care of one another. It is about loving each other. It is about finding a way to a greater humanitarian understanding of why we are here. Who are we? What do we want to be? These are deep questions that we should be asking each other all the time. And when we come to conclusions, we look to our government. Are you reflecting what we've just discussed? If the answer is yes, great. Let's foster more of that. If the answer is no, then we must change. Because life is change. Whatever it is that made America great in the past, I guarantee you was not great for everyone. Guaranteed. I mentioned this either last week or the week before. The U.S. Constitution, written in the latter half of the 18th century, was such a wonderful, perfect document that you know what they did? Before the ink was even dry, they had to amend it 10 times. The Bill of Rights. And who were those rights for? White men. It wasn't for women. It wasn't for people of color. And oh, God have mercy, if you were a Native American, you were fucked. We will never, ever, ever make up for what we have done to African Americans and Native Americans and women. And what we continue to do to all the above and more. Latinos, Asian Americans, Muslims. We're never going to make up for it. But we have to try. It's in the doing that we seek redemption, that we get the redemption. First, you have to recognize that there's a problem. And then you have to recognize where your culpability is in that problem. I guarantee you, it's somewhere. Unless your name is Muhammad, unless your name is Jesus Christ, unless your name is Buddha, you got a problem. Unless your name is God Almighty, you have a part to play in whatever problem it is we're talking about. And then you got to act. We're never going to make up for it. But we have to try. It's a moral obligation. Just as it's a moral obligation to make sure that every person in this country has access to the best possible quality health care. And I'm not just simply talking about the best health care, for your immediate needs. I'm talking about the best possible health care. There should be no ever need for any rich individual to feel that they have to go farther afield for their health care because it'll be better over there. It should be the best no matter where you go. Absolutely the best no matter where you go. There should be no reason for private insurance so that someone can get something faster. Because I paid for it. I'm going to get what I paid for. You get the best. Because this is America. And we offer the best. No more is, this is America. You got to pull yourself by your own bootstraps. No more of that. No more. That is not how we build a great society. That's how you might build a great personal empire, but that is not how you make a great society. Get rid of the blanket, Jeff? Message. I'm sorry. Excellent. I am working on a set. I'm sorry. Look, my wife put up a black one, but it made it look like I was a terrorist making demands. But what we want is a more perfect union. That's what the preamble says. We, the people of the United States of America, in order to form a more perfect union, forever reaching for the stars, never actually getting there, but always reaching for it, always making sure, are we doing the best we can? Is this the best that there is? Is there anyone left behind? We are strongest when we are together. We are strongest when we are united. We are strongest when we are kind and loving and include as many people as possible. That is strength. Strength through compassion. Strength through love. You start off with this good feeling in your heart that you want for everyone, and then you act accordingly. I've said this before. I'll say it again. I'll say it until it catches on like wildfire. MMT, without love, is the military-industrial complex. MMT with love, that's Medicare for all. That is single payer. That is universal coverage for everyone. That is free college education for everyone. That is world-class infrastructure, complete with updates regularly so we don't ever have to have this crumbling infrastructure ever again. MMT with love is the federal job guarantee, raising wages for everyone, providing dignity for everyone, increasing the ideology about what work is. What is your passion? What would make you feel like you are contributing something to this country? And we can make that happen. We can create the conditions that would allow you to thrive. And that makes the country thrive. These are choices. MMT happens whether you want it to or not. MMT happens whether you are fear-based or love-based. It's going to happen. It happens now. But what are you going to do with this knowledge? Every day you have a choice about what you're going to do. You walk into your job and you have a choice of going up to your boss and saying, hey, how can I help today? How can I be a better part of the team? Or you can walk up to your boss and say, you know what? Fuck you very much. I never really enjoyed you. Fuck you. Well, one is definitely going to get you fired. And the other one is going to make your work life so much better. And if you don't like your boss, then say that to your coworker and leave your boss alone. I don't know. But it's a choice. We choose how we talk to each other. We choose how we interact with one another. We choose what we act upon and what we don't act upon. And as soon as you know, Teresa, reach one, teach one. Absolutely. As soon as you know what the score is, you have a choice. And if you know what the score is and you're not satisfied with where we are in this country, with the direction that we're headed in, and you choose to do nothing, well, I'm not going to say anything. But that's a damn shame. Because we could have everything. But like I said, it can't be me. If it were just me, nothing's going to happen. Because why would anyone in power listen to me? But someone in power would listen to us. All of us. All of us united in a common cause. What could be more powerful than that? So your homework for tonight, just like it was last week, teach someone. Find someone who doesn't know and tell them. The Canadian health system is awesome. It is just simply underfunded and improperly funded. Tell someone that we could have single payer in here and it wouldn't be inflationary. Tell them that taxpayer dollars is a bullshit mythology if you're talking about it in terms of its funding federal spending. It doesn't. How could it? How could it? If the federal government funds itself, if it creates its own currency, if you created your own currency and you set its value and you were able to force people to use your currency, if you were able to force them, why would you ever need that money back to be able to pay for anything? Just if it's too much, just if you can't take all of MMT in, just ruminate on that one thing. If it creates its own currency, if it can set its own value, and if it can make you need that money because of taxation, if it makes you need it, why would it ever need that money back to be able to spend? Please just think about that. And if you don't know, if you can't get it around your head, email me. I am more than happy to answer any question that you have. Email anyone at Real Progressives. Email Stephanie Kelton. Email Warren Mosler. The list just goes on. The list of names is all up at Real Progressives. Ask anyone. Ask your neighbor. Even if they don't know what MMT is, just ask them that question. Just go up to your neighbor and say, look, I've got this thing. And I need to understand, if the federal government, according to Article 1, Section 8 of the Constitution, if it creates the dollar, if it sets that value of the dollar, and if it enforces taxation, which forces us to use that currency, we don't get a choice. We need to earn dollars to be able to satisfy our tax obligation. If the federal government can do that, why are we always yelling about taxpayer dollars? I don't want my taxpayer dollars going towards this. Why do I do that? Why do I say that? Can you help me out? Have you thought about this? What conclusions have you come up to? Because I guarantee you, every time I say this to someone, not a single person can come up with a whole. Not one. So the first thing we need is education. Because we need the 100 million, 200 million, 300 million people standing up. We need as many people as we can. For when we take to the streets, we need strength. We need resolve. And with love, we will strengthen ourselves and we will forge the anger that we have into righteousness so that it will be directed at a positive outcome. We're not just going to take to the streets and just start going, ah! That's fear. And it can be very cathartic, but not very helpful. Anger is fine, but it only is useful if you have love as your base. It's only useful if you use love and direct that anger. We need people to understand what MMT is so that we can get them to understand that we can have single payer. And your tax dollars aren't going to pay for it. We're not taking from you to give to them. Taxes are going to be used for redistribution of wealth. Absolutely, that's one of their functions. But it's not going to be because we needed universal health care. It's not going to be because we decided we wanted to go with green energy. It's not going to be because we wanted to invest in our infrastructure. It's going to be because the rich have so much that they're actually starting to buy politicians. They've run out of fucking shit to buy. They're buying people. So taxes do have uses. But answer this fundamental question first. Before you ask what are they used for, ask why would they ever be used to fund a federal program? Why would the government ever need a revenue stream if it creates its own money? So, I'm going to leave it there. Talk to your neighbors. Talk to your friends. Talk to your enemies. When you have your conversations online, we need allies. We need allies, and it is very cathartic. Yes, Teresa, they've already bought the politicians, so we need to do something about that. It's very cathartic to throw names, to get combative. I get it. You know, I've been there. You got to do the best you can. You got to do the best you can. No one is perfect, and no one is going to get it perfect every time. But if someone is yelling at you, it's not about you. It has nothing to do with you. I'll leave you with this. There's an old Buddhist teaching that says, your life is water. If your life is a glass of water or an ocean, and someone comes up to you and says, fuck you, you're a son of a bitch, that is the equivalent of taking a thimble full of ink and pouring it into that water. If your life is a glass of water, pouring that ink is going to muddy up your life. Pouring that ink is going to make you feel like crap. God, you think I'm an asshole? You think I'm a son of a bitch? Oh, God. But if your life is an ocean, and someone comes up to you and says, fuck you, you son of a bitch, that would be this, taking that same thimble and pouring it into an ocean. Hasn't fundamentally changed your life at all. So if someone comes up to you and says, fuck you, you can say, okay, well, you've given me something to think about there. Thank you very much. And you move on. Because it has nothing to do with you. They call you names. It has nothing to do with you. It's not personal. They want to make it personal because they simply want to win an argument. They would rather win by shutting you up than win with facts. So give them facts. Give them love. Give them compassion. Give them everything that is your birthright. We come from God. We come from love. We are filled with it, whether we choose to use it or not. So just remember, your life is an ocean. And there's not enough thimblefuls of oil to fundamentally change that at all. So choose love. Choose love, choose righteousness, choose anger if you have to, but always with love. So that when you have the conversations that we must have, that we need to have regularly, hopefully it's the love that comes through. It's the compassion that comes through. Because we're fighting for the people that we're fighting with. I don't like oligarchs, or more specifically, I don't like oligarchy. I said with Dr. Cornel West used to say this. It's not oligarchs that we hate, it's oligarchy, because oligarchs are human and they can change their mind. And for so long as that is still a possibility, don't waste your time and your energy with hate. Fight what they do. You don't have to fight them. You don't have to make it personal. Fight what they're trying to achieve without making it personal. Because if we get what we want, if we get what we deserve, they're going to be fine. They're going to get everything that they need and most of what they want. So we don't have to fight them. We don't have to rub their noses in anything. People make mistakes. I know that people, they can't stand people that voted for Trump. Okay, I get that. I seriously do. About a week after the election, if you want to go onto my Facebook page and scroll down to a week after the election and read what I wrote, you'll see that I got very fucking pissed. But it's not worth it trying to rub their noses in it. It's not worth it. Guaranteed. Whatever small measure of satisfaction you'll get from going, see, I told you so, you son of a bitch, you did this to us. Fuck that. We don't need that. That's not helpful. We want to move forward. That doesn't mean that we forget. That does not mean that we forget. I know that people are going to be on the Bernie versus Hillary side of this argument. What do you mean I got to get over it? I'm not saying get over it. I'm saying move forward. I'm not saying forget about what happened. I'm saying, do you want what you want? Or do you want what we all need? It's fundamentally different. So, do the best you can. Do the best you can. It's all you can guarantee. You're going to succeed most of the time. You're going to fail some of the time. It's okay. Just have the conversations that we need to have. I love you all very much. I'm going to be back again next week. Email me with anything that you want me to address, either in greater depth or a different story you'd like me to talk about with healthcare. I've got tons of ideas myself, but I'm always open to suggestions. Also, if you've got critiques, please, I'm open to all that as well. So I'll see you all next week. I love you all very much. Have a great night. Bye-bye.